Assalamualaikum warahmatullahi wabarakatuh. My name is Sofea and I'm from class C1. Today I'll be presenting to you about drug interaction between monoamine oxidase inhibitor and Tyramine-Rich food. So we'll start off with introduction. What is drug-food interaction? It is a reaction between a drug and a food, beverage or dietary supplement. Why is this important for pharmacokinetic? It can alter drug absorption, distribution of drug is modified, metabolism, impact, and last but not least, excretion is influenced. First, we'll go through the component absorption out of the 4 ADME component. So for absorption, food usually affect the drug absorption, which will result on the reducing or increasing of the bioavailability of the drug. There is 5 main points for this absorption method. First, it can delay of gastric emptying. When food is in stomach, drug absorption will reduce because of there's something in our food, so there's not much space for drug to be dissolved and absorbed in the body. Second, gastric pH is altered. Some drugs favor acidic environment, so when there is food in stomach, gastric pH will decrease, so absorption rate might decrease too. After a meal, the third one is complex formation. Some food contain calcium, iron, and magnesium, so they may chelate with antibiotics, and this will reduce drug absorption. Fourth, diet composition. High fat or protein food could either increase or reduce drug absorption. And the last point, inhibition of molecule. Okay, so this is quite well known, but did you know that grapefruit juice is known to be able to block P-glycoprotein and CYP3A4? Yeah, this will increase absorption and increase concentration of drugs in blood. As for the point distribution, drug is less likely to affect distribution of drug, but it can happen. So we'll be talking about 2 points, which is binding at plasma protein and solubility toward lipid. So high protein food has high serum albumin level. This will cause the distribution of highly protein bounded affected. And the second one is solubility toward lipid. Lipophilic drug increase tissue distribution. This will cause fat-based food to increase absorption of fat-soluble drugs. As for metabolism, regulation of drug metabolism by food could happen by affecting liver enzyme. Inhibition of enzyme will cause food block enzyme in specific organ, hence increased body systemic exposure to drug. And the second one is enzyme inducer. Some food induce liver enzyme. This will increase metabolism of body and decrease efficacy of drug. For excretion, food contributed to drug excretion too. Changes of pH may happen because food can alter pH or urine of human. This will affect renal excretion of some drugs. And the last one, drug and food fight for transporter. Filtered food molecule will compete with drug molecule for renal or biliary transporter. This will affect elimination of drug, and some drug may take longer to be excreted from the body. So now we'll be looking for mechanism of interaction. First of all, I'm going to introduce to you guys about MAOI, monoamine oxidase inhibitor. It is a drug used for depression. What is tyramine? With sympathomimetic characteristic, tyramine is a trace of monoamine. It is usually found in food, plants, and animals. Fundamentally, monoamines have amine groups separated from the aromatic ring by a 2-carbon chain. They are called trace monoamine because they are naturally low frequency in mammalian tissue, contrast to the one that's found in neurotransmitter. Example of tyramine-rich food is cheese, sourdough bread, kimchi, anything fermented, alcohol, processed meat, and nuts. We'll be going into deep of the mechanism of interaction between MAO and tyramine-rich food. So first, enzyme monoamine oxidase A, MAOA, an enzyme that breaks down monoamine transmitter, the neurotransmitter will metabolize tyramine in the body, GI tract, and liver. This will inhibit significant amount of tyramine from entering body systemic circulation. When patient took monoamine oxidase inhibitor, the monoamine oxidase A activity will be blocked by monoamine oxidase inhibitor, resulting in inadequate metabolized tyramine, and tyramine will accumulate in the patient's bloodstream. Higher level of tyramine will enter adrenergic nerve terminal and took place of norepinephrine from the starch vesicle, which causes sudden and over-releasing of norepinephrine into the synaptic cleft. This stimulates alpha-1 adrenergic receptor, leading to vasoconstriction and rapid increase of blood pressure. Sometimes this is called as the cheese effect. So we'll learn about pharmacokinetic effects of this interaction. For the absorption, tyramine is readily absorbed by GI tract. So the drug doesn't really change the rate of absorption of tyramine, but in distribution, when tyramine is in the systemic circulation distributed thoroughly in the body, tyramine also is not significantly affected by MAO during distribution phase. In metabolism, this phase is the most affected phase out of the four. The enzyme play a vital role for tyramine oxidative deamination. When the drug inhibits the enzyme function, tyramine level increase in blood. And for excretion, since tyramine is not metabolized, there will be trace of tyramine in the urine during the excretion phase. Now we'll be looking to clinical consequences. Potential risk is chest pain, upset stomach, severe headache, sweating, nosebleed, shortness of breath, changes in vision, and stiff neck. And if you are not lucky, some patient could even go into a stroke because of the hypertension caused by the tyramine level. For patient counseling points, patients should avoid Tyramine-rich food while taking the drug, avoid food that has not been properly stored or are spoiled. Patients should eat fresh food, veggie, fruits, and patients should reduce intake of processed and fermented food and beverage. Alternative drug suggestion: patients can use selective serotonin reuptake inhibitor such as fluoxetine, paroxetine, and fluvoxamine. Some patients could also take serotonin and norepinephrine reuptake inhibitor such as duloxetine, venlafaxine, desvenlafaxine. And last but not least, patients can try tricyclic antidepressant such as nortriptyline, imipramine, amitriptyline. For the monitoring advice, hypertensive crisis symptom is a must to be taken note by the patient. Serious dog interaction or short period after changing from MAOI to another drug, anesthetic during surgery. Patient must monitor their serotonin syndrome and behavior changes. If somehow you are still confused, don't worry, reach out to your medical professional. They got you covered. Now for the reference part. Here are all the references that I've been using to make this slide and this video. Thank you for your attention, and I wish you guys have a good day.